Hi everyone, this is Journey Abroad and welcome to our channel. We have a helpful topic today. It's about caregiving question and answer that you might encounter on your upcoming exam. So I compile some set of questions, and the topic for today is caregiving vital signs and CPR. So it might be helpful to all of you. So let's start. Question number 1. The amount of force exerted against the walls of the artery by the blood is commonly referred to as. The answer is blood pressure. So another question. Which can increase the pulse rate? So the answer is pain. Okay, another question. The nurse assistant is taking routine vital signs on a patient or resident who is known to have an irregular pulse. The nurse assistant should take the answer is radial pulse for 1 full minute. Okay, next question. The radial pulse is the most common site used for routine vital signs. The radial pulse is located on. The answer is the thumb side of the wrist. Okay, another question. A patient or resident has a temperature of 102 Fahrenheit. What can a nurse assistant do to assist in lowering the fever without a physician's order? So the answer is encourage the patient or resident to drink cool fluids if allowed to have an oral intake. Okay, another question. Which of the following signs is not associated with fever? The answer is the decreased pulse. So the nurse assistant is preparing to take a patient's resident blood pressure. The patient or resident has an IV in the right arm. The nurse assistant should. The answer is take the blood pressure on the left arm. Okay, the nurse assistant should know that the first sound heard when taking a blood pressure reading is called the answer is systolic pressure. So another question, when taking a patient's resident vital signs, which of the following should the nurse assistant recognize as abnormal? The answer is pulse 124. Okay. When the patient or resident returns to his room after a short walk, he reports shortness of breath and tightness of the chest. What should the nurse assistant do first? So, the answer is take their vital signs. So, another question. When a nurse assistant is unable to obtain a patient's or resident pulse rate, what should you do? Take the pulse. The answer is take the pulse for a full minute at another location. So another question. The nurse assistant is taking a patient's resident blood pressure. To read systolic pressure a second time, the nurse assistant should. The answer is deflate the cuff completely and wait 1 to 2 minutes and retake the blood pressure. So to take a patient's resident pulse, the nurse assistant should. The answer is take the pulse on the thumb side of the wrist. So another question, which of the following happens frequently and may not be discovered until the next shift? The answer is recording on the incorrect health record. During which step of the nursing process would your record direct quotes from the client and or his family? The answer is assessment. One area that is often excluded from assessment details is that of not recording blank. The answer is emotional status. So another question, there are 3 basic steps you can take in an emergency. What are those? The answer is call, check, and care. Okay, a girl is not breathing but has a pulse. What would be the best course of action? The answer is call 911 and begin rescue breathing. Okay, another question. When performing adult CPR, you give blank. The answer is 2 slow breaths and 15 chest compressions. Okay, another question. When performing CPR on a child, you give blank. The answer is the answer is 1 slow breath and 5 chest compressions. Another question, when performing infant CPR or rescue breathing, what kind of breaths should you give to avoid forcing air into an infant's stomach? The answer is slowly and gently. Another question, when should you give rescue breathing? The answer is unconscious, not breathing, but has a pulse. Okay, another question. A girl is not breathing but has a pulse. What would be the best course of action? The answer is call 911 and begin rescue breathing. Okay, next. Where would you check the pulse on a 12-year-old boy? The answer is at the side of the neck. Okay. Next, what is the CPR procedure for a 6-year-old boy? The answer is 5 compressions, 1 breath, 12 cycles in 1 minute. So next question, a girl is unconscious. She is heavily dressed and her skin is reddish, dry, and hot. What should you do? The answer is check for breathing and pulse, call 911, get the girl out of the heat, loosen tight clothing. And that's it. Another question, when performing CPR on a child, how deep should the chest compressions be? The answer is 1.5 inches. So, which of these are hypertension? What is a hypertension? So, the answer is greater than 120/80 mmHg. So, that is all about the topic CPR and vital signs. So, it is important for you to know that. So, if you have questions on the actual CPR of caregiving that we perform on the day of the assessment, I will include the link below and you can watch it. And good luck to your test. And for the next videos, I will compile some of the questions and with answers with a different topic in caregiving. So again, please subscribe to our Journey Abroad YouTube channel and please leave a comment if you have questions. So again, we are all rooting for you to pass your exam and to succeed in your life. So thank you for watching and God bless you on our next videos. Bye!